Hello and welcome to the Department of Neurosurgery Preoperative Spinal Seminar. My name is Kate. I will be narrating this seminar. Before we begin, please don't feel as though you need to be writing everything down, as this document may be printed, and most of this information will be contained in your discharge instructions. Let's begin. On the day of surgery, you will be coming in through the entrance at 75 Francis Street. The easiest way to find 75 Francis Street is to follow the signs to the emergency room. You may pull in there. There is valet there. The valet is there 7 days a week, 24 hours a day. And by valet parking your car, your loved one or your coach can then come in with you in the admitting office and can stay with you and go downstairs into the pre-op holding area until it is time for you to go into the operating room. At that time, we would encourage your family member to proceed up to the family waiting area or possibly wherever they may be going for that day. The patient then goes into surgery. After surgery, everyone comes out and hits what we call the recovery room or the post-anesthesia care unit. And from there, you will either be transferred to the extended recovery room or transferred up to a floor. For those of you who are coming in under a PPR status, which is post-procedure recovery, you will remain downstairs on L1, and the expected time of discharge would be 8 a.m. the following day. And for anybody who is being admitted, you will be transferred up to an inpatient floor once a bed becomes available. I would like to add that if you are listed as an admission status and you do wind up downstairs overnight in the recovery room, it is because our census is high and our bed availability is low, but we will do our best to get you up to an inpatient floor as quickly as possible. Post-surgery, whether you're in the recovery room or up on an inpatient floor, the care will be the same. Everyone's vital signs will be checked. Your surgical dressing and or incision will be checked. There's a possibility that patients will come out with oxygen. Everyone will have IV fluid running. There is a possibility that you may have an indwelling Foley catheter. There is a possibility that you may have a surgical drain, and that will depend on your procedure. Everyone will be placed in their pneumatic compression boots, which you can see here to the right of the slide. They help maintain blood flow to your joints and heart, and they help to avoid DVTs and blood clots. The nursing staff will be assisting everyone with turning and repositioning, so everyone should expect to be moving postoperatively. It is safe to turn and roll in your bed postoperatively, and many of you will be standing at the edge of the bed, and we do encourage patients to take a few steps and possibly walk as quickly as they are able. But again, many of you will be up ambulating the night of surgery, and I do encourage you, if at all possible, to attempt to get out of bed and ambulate to the bathroom. Progressive mobilization. For those of you who are unsuccessful in your first few attempts to get out of bed the day of surgery, we will contact physical therapy to come in and help work with you, review log rolling with you, show you the proper ways to be getting in and out of bed, and help you get on your feet. We like to set a goal for the day or two after surgery of being up 5 times a day. If everyone is up for their meals and out of bed to the bathroom, it's fairly easy to hit that target. Again, this is on post-op day 1 or day 2. We do expect that you will be out of bed more frequently once you are at home. Your goals versus your precautions. We do say that everyone will be walking independently 1 to 2 days after surgery. You will be walking greater than 100 feet. I tell patients it's safest to begin inside the home and then gradually work your way outside, but to increase your distance gradually, maybe taking short walks every 1 to 2 hours. You will be going up and down stairs, and if needed, physical therapy will work with you to review stair climbing and safety tips for anyone who may feel a need. And they will be discussing with you to please limit any type of deep bending, excessive twisting, or extreme weight lifting, we do restrict everybody to a 10-pound weight restriction for the first 2 weeks. Beyond that, each of you will get an individual weight progression as far as how you should be progressing after the first 2 weeks. If we do need to bend, lift, pick up something, please use proper body mechanics, bending your knees, limiting the weight of what you're picking up the first 2 weeks that we're home. Pain management in the Universal Pain Assessment Tool. We do use the Universal Pain Assessment Tool here in the hospital. This is for your review, but the staff will be coming in asking you to rate your pain on a scale of 1 to 10, and they're referring to this Universal Pain Assessment Tool. I do tell patients it's normal and expected to have pain post-operatively, but we do encourage you to do your best in trying to get out of bed, that the pain hopefully will not be limiting you to be in and out of bed the first couple of days after surgery. We do have our patients here sign a controlled substance agreement, which means you are obligated to take the prescriptions and follow the rules as directed by your surgeon. I also like to tell patients that if for some reason you are not interested or do not want to take narcotics post-operatively, we do have alternatives that you can discuss with your inpatient care team. Please keep in mind that we usually send patients home with about a week's worth of pain medication, and if patients are requiring a refill on their narcotics, you do need to call the office. We do need 2 to 3 days to get that refill out and sent to the pharmacy for refill, so please don't wait till the last minute and call when you're down to your last 1 or 2 pills, as we don't want you to run out of your pain medication. Again, I encourage patients to call a day or 2 before they need their refill and let someone know, and we will do our best to get a refill prescription to you if needed. Drinking alcohol is prohibited while you are taking your narcotics. And again, we do ask that you take them as prescribed. If you are having trouble managing your pain at home, I ask that you call the office and speak to your provider. In regards to the discharge process, we do tell patients that they should anticipate leaving on the day of discharge prior to noon. For those of you who are overnight in the recovery room, we do our best to try to get patients discharged between 8 and 9 a.m. Prior to leaving, we try to get a dressing change done, a picture of your incision, so that you can go home with a picture of your incision on your phone, so that you will have a baseline as to what your incision looks like on the day of discharge. If anyone is going home with a dressing on their incision, that dressing is to be removed on post-op day 3 days out from surgery. So whether there is gauze covering your incision or a Band-Aid, we ask that you remove that 3 days out from surgery. But again, if you do have any concerns in regards to this seminar, you may reach out to me via Patient Gateway. My name is Kate Hill, Hill, or I can be reached via email at khhill@bwh.harvard.edu. Thank you for participating in this seminar, and I look forward to meeting you post-operatively. Take care.